Imagine waking up one day to find that our healthcare system has suddenly ceased to function. One moment, everything is as it should be, and the next, it's as though the very bedrock of modern society has been ripped from beneath us. This is a cyber apocalypse, a catastrophic event where our digital world suffers a system-wide shutdown. Picture this, our healthcare industry, the lifeline of millions, brought to its knees not by a physical calamity, but by invisible lines of code. Hospitals once bustling with the rhythmic pulse of life-saving activities abruptly fall silent. The hum of machinery, the beep of heart monitors, the hustle of doctors and nurses all replaced by an eerie quiet. It's as if time has stopped, but for the worst reasons imaginable. Pharmacies, too, become victims of this digital blackout. Shelves stocked with medicines become mere decorations as systems fail, leaving pharmacists unable to dispense vital medications. The supply chains that once ensured a steady flow of drugs are now frozen, locked in a state of digital paralysis. And then, there are the medical records. In this world, they're more than just files on a computer, they're the story of our health, the narrative that guides our doctors in their quest to keep us well. Now they're inaccessible, their contents locked away behind walls of digital darkness. The implications are chilling. Without these records, the risk of misdiagnosis skyrockets. This is more than just a blackout. It's a descent into chaos, where the most basic elements of healthcare become luxuries we can no longer afford. In this world, the sick cannot be treated, the healthy cannot be protected, and the very essence of medical care is compromised. And the worst part? This isn't some dystopian fantasy, it's a possibility that exists in the realm of the here and now, a grim testament to our dependence on digital technology. An unthinkable nightmare, right? But let's delve deeper into what this could mean. The scenario may be bleak, but understanding it is the first step in preventing it from ever becoming our reality. Hospitals, the life-saving institutions we rely on, would descend into chaos. Imagine a bustling city hospital, a hub of healing and hope. Now picture it silenced, paralyzed by a cyber apocalypse. The once rhythmic beeping of monitors is replaced by a deafening silence. The hospital has become a haunted maze of darkened hallways and lifeless machines. This is not a scene from a dystopian novel. This could be our reality if our healthcare systems were to be crippled by a cyber attack. Without access to electronic health records, hospital staff would be forced to navigate blindly, unable to call up a patient's medical history or vital signs. Doctors would be stripped of their most valuable tool, information. The potential implications are terrifying. How would a surgeon proceed without knowing if a patient has an allergy to certain medications? Or how could a doctor prescribe the right treatment without access to previous diagnoses or lab results? The lack of critical data could lead to dangerous misdiagnoses, inappropriate treatments, and preventable deaths. Meanwhile, the hospital's communication systems, vital for coordinating care and handling emergencies, would crumble. The silent phones and dark screens would create an information blackout, further escalating the crisis. Nurses would be unable to call for help, doctors could not consult with specialists, and desperate family members would be left in the dark, anxious and uninformed. Beyond this, essential equipment, from ventilators to MRI machines, would be rendered useless. These are not just tools, but lifelines for many patients. Imagine the despair of watching a loved one struggle to breathe, while the ventilator that could save them sits idle, a victim of the cyber onslaught. The chaos would stretch far beyond the hospital walls. Ambulances would be left without a destination, their onboard equipment and communication systems disabled. Emergency rooms would overflow with patients, while others would be turned away, their conditions worsening with every passing minute. A hospital once a beacon of hope, now a symbol of despair. The immediate aftermath of a cyber apocalypse would be a harrowing testament to our dependence on technology, and it's a stark reminder of the need for robust cybersecurity measures to protect our most vulnerable institutions. Imagine walking into a pharmacy, only to find they can no longer dispense your much-needed medication. In a world that has become heavily reliant on technology, a cyber apocalypse would have dire consequences for pharmacies. The intricate web of supply chains knitted together by digital threads would unravel, leaving pharmacies unable to replenish their stocks. Imagine a world where the shelves of your local pharmacy are barren. The once reliable flow of life-saving medications halted, but the crisis doesn't stop there. The ability to verify prescriptions, a process that has long been digitalized, would be lost. Pharmacists would be left in a precarious position. How do they determine the authenticity of a prescription without their trusted systems? And what about controlled substances? The potential for misuse and abuse would skyrocket, creating an entirely new set of problems. Now, let's consider the public's reaction. The panic would be palpable. The thought of being without necessary medications would instill fear and desperation in many. Diabetics without insulin, heart patients without beta blockers, those battling mental health issues without their stabilizing medications. It's a scene of despair and chaos. Yet amidst this crisis, we might also glimpse the resilience of the human spirit. Community-led initiatives could emerge, with neighbors helping neighbors, sharing resources and finding alternative solutions. Herbal remedies, long forgotten in the age of modern medicine, might make a comeback. It would be a time of innovation born out of necessity. But a question lingers: how long could we sustain such a system? Without the efficient distribution and validation processes we've become accustomed to, would these makeshift solutions be enough? The strain on both individuals and communities would be immense. The pharmacy, a place we've come to associate with healing and relief, would become a symbol of a world in disarray, a stark reminder of our vulnerability in the face of a cyber apocalypse. Our lifeline to health, severed by a cyber apocalypse. Your medical records, a critical tool for your doctor, have suddenly vanished into thin air. Now imagine the implications of this seemingly impossible scenario. Medical records are much more than just sheets of paper or digital files. They are comprehensive chronicles of our health history, detailing past illnesses, allergies, treatments, surgeries, and medication regimes. In the hands of medical professionals, these records serve as a roadmap, guiding them towards accurate diagnoses and effective treatment plans. But what happens when this roadmap disappears? Let's delve into a hypothetical case. Meet Jane, a middle-aged woman with a complex medical history, including a rare genetic disorder that affects her clotting factor. This condition requires specific medication and careful monitoring. Now imagine her medical records, the ones containing vital information about her unique health needs, have vanished. Without access to Jane's records, her healthcare providers are forced to operate in the dark. They don't know about her genetic disorder or her medication needs. This lack of information could lead them to prescribe a medication that might interact negatively with her existing condition, or fail to prescribe the necessary medication altogether. This scenario, while hypothetical, illustrates the very real danger of misdiagnosis and incorrect treatment that could occur in the event of a cyber apocalypse. It's not just about Jane. It's about the millions of individuals worldwide with complex health histories who rely on accurate medical records for appropriate care. Furthermore, the absence of these records could potentially expose patients to unnecessary and potentially harmful treatments. It could lead to the failure of early detection of serious illnesses, and it could even cause medical professionals to overlook life-threatening emergencies. The situation unravels quickly, doesn't it? Suddenly, we're not just talking about lost data, we're talking about lives at stake. The loss of medical records in a cyber apocalypse isn't just a logistical nightmare. It's a direct threat to public health. In conclusion, remember this. Medical records are more than just data. They are the lifeline of healthcare delivery, the safeguard of patient health, and the compass for medical professionals. A single piece of data, the difference between life and death. A cyber apocalypse has swept the healthcare industry. What does the aftermath look like? Imagine waking up in a world where the lifeline of modern medicine has been severed. Hospitals, pharmacies, and medical records, the pillars of healthcare, have been brought to their knees, crippled by an unseen enemy lurking in the digital shadows. The long-term consequences of such a disaster are profound, with the ripple effects felt far beyond the immediate chaos. The societal implications are staggering. Imagine a world where trust in healthcare, a fundamental cornerstone of our society, has been shattered. The faith we place in our medical system, the confidence that our personal health data is secure, the reliance on digital systems for life-saving treatments, all have been compromised. This isn't just about the disruption of services, it's about the erosion of trust. And rebuilding that trust, it's a monumental task that could take years, if not decades. Beyond the immediate crisis, the aftermath of a cyber apocalypse in healthcare would be a time of great uncertainty. With the integrity of data compromised, the risk of misdiagnoses would remain high. The disruption in medication supply could continue, with pharmacies battling to regain their footing. Hospitals would struggle to restore services, all while dealing with the fallout from the crisis. But perhaps the most chilling aspect of this scenario is the potential for similar future crises. The cyber apocalypse serves as a stark reminder that our healthcare system, like many other aspects of our modern world, is vulnerable. It's a wake-up call to the importance of robust cybersecurity measures, of the need for constant vigilance in the face of ever-evolving digital threats. In the aftermath of a cyber apocalypse, we're left to grapple with a new reality. A reality where the digital realm can have tangible, potentially devastating effects on our physical world. A reality where our trust in systems we've come to rely on can be shattered in an instant. A cyber apocalypse, a chilling reminder of our vulnerability in the digital age.